India Today exclusive. Top global health expert Christopher Murray has projected the number of infections for peak wave in India. He said that detected infections globally will reach 3 times of the previous waves. Take a look.
You have given some predictions and the modeling studies based on which you say that there could be at least 3 billion infections in the next 2 months. That seems to be a big number, but what are your current projections for India that's already looking at a slow emergence of the 3rd wave of coronavirus led by Omicron?
Well, because India had such a terrible Delta wave, that combined with vaccination efforts suggests that there's quite a bit of immunity in India that will provide some protection against Omicron. So what we expect to happen is lots and lots of Omicron infections, reaching a peak in the end of January or first week of February. The number of infections per day may get up as large as the Delta wave back in April and early May. But the big difference is that the Omicron is not going to cause the death and hospitalization that we saw before. And so the other thing about Omicron that's very different is a much larger fraction of people have no symptoms at all. So they may never get detected. So the official case data may not increase in India anywhere near what we saw with the Delta wave.
So, Doctor, essentially what you're saying is we could probably see the similar number of cases we saw in the 2nd wave. India peaked at about 4 lakh cases during the Delta wave, but these were very severe infections as well. And you're saying that Omicron is not going to cause increase in hospitalizations and death, despite the fact that case numbers will be large?
Well, I think it's very important for people to recognize the difference between infection and an official case. With Delta, many of the infections got eventually detected and became a case in the official numbers. But with Omicron, with 90% of people having no symptoms at all, most of those people will never become an official case. And so there's going to be this very big distinction between true infections in the community and the number of cases that you pick up. And then even amongst the cases that get diagnosed, that get tested and get recorded, we know with Omicron that a smaller fraction will go to hospital than for Delta. And amongst those that go to hospital, a smaller fraction will end up needing the ICU or intubation. So putting all that together, we expect some increase in cases, some increase in hospitalizations and deaths, but dramatically less of a threat for India than the Delta wave.
Let's bring you the number of Omicron cases in India now. India has over 2,100 Omicron cases, over 300 new Omicron cases in the last 24 hours itself. Here's the breakup of the Omicron cases in the country. A total of 2,135. Rajasthan is 174. Delhi 464 Omicron cases. Gujarat 154. Maharashtra the highest, 653 Omicron cases, and Kerala at 185.